Hello, everyone. This is our screencast for this week. And this week we are looking at case reports. So, case reports, these are stories about patients, actual patients that came in for therapy services. And these reports detail those therapy services that are provided by the authors. So, they are stories about real clinical situations. As such, hopefully they are very palpable to clinicians. Sometimes clinicians will complain, oh, that was done in a research lab, that can't be done in a clinical situation. Now, I would make arguments against that and I'd push back against that myself. But what is really valuable about case reports is that they are typically written by clinicians or they're written by people who have a clinical component to their job and they are sharing information about the successes and or failures with providing therapy services in real clinical environments. Now, case reports model evidence-based practice. They convey experiences from one clinician to other clinicians. They can suggest hypotheses for future research. You may read that a lot in some of the case reports. As we get to the discussion section, they may say, based upon the successes achieved in this case report, we recommend future research to do X, Y, and Z. They can provide material for teaching and learning. They can assist in the evolution of theory, and they can help in developing practice guidelines. So, case reports highlight unique clinical problems or unique challenges. They can also highlight common problems or challenges that are not addressed in other forms of the literature. They can address measurement issues, differential diagnoses, or the process of coming up with a differential diagnosis. They can highlight the processes for decision making in a clinical environment. And there are a variety of journals out there. And so there could be journals where it would be appropriate to write a case report on an administrative program. Now, I'm not familiar with that too much. I haven't really read administrative programs, but for example, from a case report from an educational perspective, there have been members of our faculty that have been asked to write essentially a case report about how we sometimes do distance education with the synchronous live presentation of Dr. Mazzaros or Dr. Hauk while they're broadcasting from their homes back east. There are case reports highlighting community-based interventions as well as addressing ethical dilemmas. Case reports are not research reports. And you've probably seen by now the pyramid, the hierarchy of evidence or the levels of evidence for research. Where do case reports fit on that? They fit in at level 5 at the bottom of the pyramid. Also, level 5, expert opinion. So, case reports aren't experimental. They are not research reports, but again, the information that you get from them can be very valuable. So, for example, here is a little snippet of the front of a article that I published in Physical Therapy and Sport back in 2009. This is a case report. What I'm doing is I'm applying evidence-based practice in it. This report is not detailing for the first time ever how to treat somebody with a glenohumeral dislocation. So I'm relying upon research to inform my practice. What my case report is doing, though, it's highlighting the rehabilitation of a Division III collegiate level female wrestler as she tries to return back to sport. Now, what's kind of novel or different about this is at the time, female wrestling was not commonplace within the collegiate level. And what's also interesting or novel about it is that we were able to rehab her during the season to be able to get her back to the point where she was able to compete at nationals. So a case report kind of takes on, this figure kind of represents what a case report is all about. So basically, time represented there, time is at baseline or at the start, whatever moment that patient comes to you. So the participant there is the patient or the client. And you move forward in time with that individual, providing treatment to them, or if this is a healthy client that you're doing some sort of exercise intervention, whatever it may be, you are working with them. And then at the end of your time working together, you have information about the outcome. What occurs next is if you think the case is interesting, you retrospectively go back and look at things. Okay, what kind of information do I have here? What can I what can I put together to write up on this person to share or convey this information? And so that's what the bottom arrow is doing. That's kind of retrospectively going back in time to when you first met the patient or client, and then starting to review your chart notes or whatever notes that you've collected for this person. And then you can assemble a manuscript from that. And one thing I'll be doing throughout this lecture is showing you plenty of examples and highlighting to you how you can be involved in the case report writing process. Because as a clinician, and probably all of you or the majority of you, that's going to be your main gig once you graduate from school, is you're going to go out and work in clinical practice. And probably for the majority of you, you'll have no interest in doing research or going back to school to get another degree or anything like that. But one thing all of you can do is participate in case report writing. A case report is not a single subject design, also known as a single case design. This is not a case report. A single subject design is actually an experimental study. And we'll talk about these at some point during the term. But it's important right now just to differentiate that this is not a case report. Case reports do not require review by an institutional review board. It does not require approval from that research body. Single subject designs do. Since this is experimental, they do require IRB approval. And just to kind of tease why, one type of single subject design study is the use of medications to see if a medication works for somebody. And so in a single subject design, you have a period of time where the person's receiving no treatment and taking measurements on them. That's kind of like the baseline. And then you intervene where you might give them the drug. And there's several different designs. There's an AB design, an ABA design, and an ABAB design. So you're trying to see how that intervention affects somebody and does it make permanent changes or temporary changes. But again, we'll come back and discuss more about single subject designs at a later lecture. There is also something called a case series. And probably the easiest way to think of a case series is a case report of several patients. So essentially, a case series is 2 or 3 or more case reports all wrapped up into one situation. So, for example, you have a problem or a challenge, and you're wanting to maybe change the way that you do therapy for a certain population of people. So, what's an example of this? Well, I'll upload this article to Foxtail by Mascal et al., published in the Journal of Orthopedic and Sports Physical Therapy around 2003. In that paper, they called it a case report, but you could also maybe call it a case series, or if they had two or three more subjects that did the same thing, you could definitely call it a case series at that point. There's no hard and fast rule like, oh, the cutoff is three or more and becomes a case series, two or less, it's a case report. So there's no hard and fast rule. So, but the point of the example here is in that paper, they had patients with patellofemoral pain, so pain in the anterior knee. At one time, the standard approach in physical therapy was to emphasize strengthening exercises for the quad. What Maskell et al. Found, or what they thought, was you know what? Some patients maybe aren't getting better with just doing a quad only approach, or recognizing that the muscles of the hip play a valuable role in maintaining lower extremity um, alignment, that it could be beneficial to increase strengthening exercises or to prescribe strengthening exercises for patients with patellofemoral pain syndrome. And so that's what they did. And then they reported on the outcomes. That was a very influential case report or case series. And now it's pretty much standard practice that if you have a patient with knee pathology, even if it's patellofemoral pain, that you've got to include strengthening exercises for the hip, like side lying straight leg raises, maybe prone straight leg raises, clamshells, when possible, getting them to doing things like squats or lunges. So, hip related exercises are very important for that population. So, a case series has addresses a problem or challenge, it applies that to several patients, and then at the end, there is the review of the outcomes and comparing and contrasting the results. Case series are also non experimental. Now, you may be saying, wait a second. At one time, the standard approach was only to address the quads. True, that was probably the primary approach. Probably some people were addressing the hip, but it just wasn't being talked about or wasn't um, being shared with the masses. And exercises for the hip, that's not experimental. That's just something to include. Experimental might be, oh, well, let's insert dry needles into the knee and see if that improves the outcomes. See the difference there? Um, there probably wouldn't be any indication, and I think even for dry needling, there's no evidence that shows that it's beneficial for knee-related conditions. At least that's my current understanding. Um, but with a case series, you couldn't do the dry needling. So typically, IRB approval is not warranted or not needed. You will notice, though, in some case series that you read, that IRB approval was achieved. And in those situations, I wonder if people do that because that's the standard practice at their facility, if maybe they were um, doing a larger ongoing study and so they got IRB approval and these were just components of that study. Typically, though, IRB approval should not be needed for a case series. All right, so case reports. Case reports, again, represent an important component of the circular process of theory development and theory testing. Case reports develop and test theory on one individual at a time. Or if there's two people or three people in the case report, they're testing it on two or three individuals at a time. There are lots of strengths to case reports. Now, again, it's the lowest level of evidence, though, level 5, but there are strengths to it, and they are really valuable for you as future clinicians. Why? Well, there is a depth of detail, a richness of information that is provided. And so you've read through some articles this term already in class, and they come across as very technical and scientific, and they may only focus on pertinent things that the researcher feels are necessary to share about the demographics of the individual. However, in a case report, especially as you read some of the case reports that are posted on Foxtail for this week, you'll see that they go more into the history in greater depth for that patient or client. And you really get a sense, if the authors do a good job, you really get a sense of being there, of knowing that patient. Now, case reports focus on the individual differences, and that's what's really valuable is you find out, oh, okay, you got hurt that way, you got hurt that way. Okay, you get a complete picture, or hopefully you get a complete picture of that individual being reported on. Case reports also present unusual successes or failures. Now, I haven't seen too many failures reported in case reports, and I think part of that is because who wants to have their name attached with a failure? But more often than not, you're seeing these successes. And then another strength of case reports is that they present the individualized interventions or services that that patient received. Now, there are lots of reasons to write a case report. The first two there I put in red because, one, it's so valuable to share ideas. It's so valuable to get information out there. Interestingly, as I'm recording this, back in December of 2020, Dr. Cuddyford and I published our case report, which you can see on Foxtail this week. Our case report looking at utilizing blood flow restriction therapy for 2 Division III level track athletes who had jumper's knee. Now, we did this because the athletes were in season, they were symptomatic, and we wanted to try to apply loads to their body to strengthen their thigh, to stimulate positive remodeling of the patellar tendon, and to do so while getting the physiologic benefits of doing blood flow restriction therapy so they could train at a lower load and still get all those benefits. So we published that, shared that out there. Just today, I got an email from another researcher who did something similar. I haven't had a chance yet to read their article, but they did a case report on somebody with patellar tendinopathy, and they also utilized blood flow restriction therapy. And it was very nice of them to send me a copy of their article. They had published it in a journal that has not been indexed in PubMed yet. So I had no idea that was out there. So now that there's 2 articles that are out there related to that. So it's the sharing of ideas. And you learn from the process. You learn from the process of what it takes to be a good writer, to utilize scientific technical writing, to how to submit something and go through that review process. And you've got to review the literature. To write your paper, you've got to review the literature and cite what's been done before. And so just as part of that process, you're going to learn. Other reasons why you should write a case report is that it promotes the profession, especially if you can get a case report into a physician-based journal. It shows that we physical therapists are doing good stuff. It's cool to see your name in print. It's always kind of a cool thing. You get your name in print, you get indexed, and then type your name into Google and watch all the hits pop up with all the stuffs that you're involved in. You can use it to promote your clinic. I mean, that's really valuable from a clinician perspective is if you are relying upon primary care providers or other referral sources to send you patients. Now, if you've published something in a peer reviewed journal, you can take that and use that as marketing materials. Hey, send us your patients. Here's the kind of things we're doing. And finally, it's something you can add to your resume. The first job you work at may not be your last job. And so if you have things that you can put on your CV or on your resume, yes, I got a publication. It was published this year, blah, blah, blah. That can be very valuable for you potentially for future lines of or future employment opportunities. Now, this slide here, it's titled Reasons Not to Write or Publish a Case Report. And really, it should say, but I ran out of room, it should say, these are some reasons why some people say you should not write or publish a case report. Basically, these are excuses that people come up with to not write a case report. For example, the first one, no time, no time, no time. People use that as an excuse. I don't have time to go to the gym. I don't have time to eat correctly. I need to get food through the fast food, et cetera, et cetera. In reality, if something's important to you, you can make the time. And you should never go into writing a manuscript and think, oh, well, I can sit down and pop this out in about an hour or two. No, what you need to do is set aside some time. Maybe it's a Saturday morning, and on Saturday morning from 9 a.m. to 11 a.m., you're going to schedule that time just to sit down and write a section of the article, and then you'll reschedule another time a week from now. So you can make the time. If it's important to you, make the time. I've had people say that real clinicians treat patients, they don't write about things. Now, there are some arrogant people within our profession. Well, there's arrogant people in all professions, but some clinicians kind of feel like, they kind of act like they have a some sort of superiority or god complex where it's like, "Oh yes, no, I treat the patients, I get them better. I don't have time for that." Or real clinicians don't have time. They're in the trenches. They're treating people and getting better. Well, first off, how do you know you're getting somebody better? I mean, you work with them for 4 or 6 weeks. How do you know those 4 or 6 weeks, they're really better? Did you do long range or long-term following up with them to see if they got better and if they stayed better? I mean, I can't tell you how many times my first job was at an outpatient orthopedic clinic in Medford, Oregon, where we would see a lot of the post-operative patients. And because we were right next door to a physician, an orthopedic surgeon's office, they maybe sent us probably like 75 or 80% of their patients. But occasionally, people would go other locations. And if any of you know the Southern Oregon area, really easy to get around. I mean, if you're in Medford there, it's a 5-10 minute drive to Jacksonville, 5-10 minute drive to White City, to Phoenix, et cetera, et cetera. So but some people would, instead of maybe coming to see us, maybe go see a physical therapist closer to their home, and they're just fine. But I can't tell you how many times we would end up taking over patient care, where somebody would go to see one time I had somebody that had an ACL reconstruction. They went 6 weeks to a different facility, and then after 6 weeks, they were at the physician for their follow up, and the physician was like, "This is no good. Now go see the people next door." And the reason is because the person's flexion motion was limited to 90 degrees. They didn't have full flexion motion by 6 weeks, and their extension was still shy. So they weren't getting pushed like they should. Now, the other thing about real clinicians treating patients is if you're a so called quote unquote real clinician, wouldn't your superior knowledge and skill benefit the rest of the world by sharing how you do things? Third one, about editors and reviewers being heartless. So when you submit something for review, it goes through a peer review process, and it's a double-blinded approach most of the time, like 99% of the time. And they don't know who you are, you don't know who they are, and as a result, sometimes the reviewers can be insulting. My experience is, though, when you submit a case report, they're not as aggressive. They're more aggressive with a research paper because they're being really particular to the methodology that was being used. In a case report, this is non experimental. You're just explaining your story. And so they're looking to try to help you further your story, to facilitate that story the best way possible. So, so you shouldn't worry about reviewers and editors being heartless that way. Some people would say, "Oh, I don't want to spend all that time writing. It's just going to take forever for it to get published." Well, on one hand, to get in its final magazine journal form, once it gets accepted, that might be a year or so. But what's nice is nowadays almost all journals will, once they've accepted something and gone through the copy editing, it'll get published on their website and will get indexed quickly. And so it will be available for people to review and to download immediately. Some people are fearful that colleagues will be critical. That's probably just a jealousy issue. Some people feel like they don't write well. And you know what? That's true for most people. Most people don't write well. It's a skill you've got to develop. And I can tell you from my experience with writing books, when we did some books, a couple books that we wrote a few years back, we got a lot of contributors. And some of those contributors were well known people within physical therapy who've done a lot of publications. And I can tell you, even some of those well known people don't write well. It just is something that takes time. So get yourself some software like Grammarly or something like that to help you out in the process. Another thing you could potentially do too is, let's say you are a pediatric physical therapist and you've got this great case that you want to write up, and you're like, man, my writing isn't strong, I need some help. Well, go to somebody like a Dr. Jacobson and say, hey, Dr. Jacobson, this is a case, I'd love to submit it, and I don't want you to put too much time into it, but would you mind reviewing it for grammar and spelling and all that stuff, and provide me some suggestions on things that I should include, and I'll give you co-authorship. I mean, I think that could be like a great way for you to get help, and why you want to go maybe to some people that are that from your um, schooling is because our promotion can depend upon how many publications we get. Now, there's no set number for us at George Fox, but but participating in scholarship is part of your advancement and part of your promotion. And so I can imagine that some people would love to jump at a chance to be involved with something like that. How about if no one would be interested? You might have that thought, oh, I'd do all this, no one would care. Well, if you care, I guarantee you there's somebody else out there that would care. And I can tell you from my own experience, there's a website called ResearchGate. ResearchGate is kind of like social media for academics, for people involved in research and things like that. And you can go to ResearchGate. Anybody can get a free profile at ResearchGate, and it gives you an opportunity to go and download articles that are kept there and so forth. Well, you're able to find out how many downloads, how many people have looked at things, and so I can tell you, case reports get a lot of attention. People like looking at them. And the final one here is that you won't get paid. Well, that's true. No one's going to pay you for writing a case report. However, there could be benefits for you in the long run when it comes to marketing as a clinician if you shared your case report with referral sources, or to differentiate yourself if you were to compete for another job in the future. So let's get into some of the how-tos. So it's just some general information here. You need to select a case or cases to report on. Now, the majority of patients that you work with, there'll be no need to write up a case on them. For example, you're going to work with, if you go into outpatient orthopedics, you're going to work with patients that have had ACL surgeries. Absolutely, probably no reason to write a case report on somebody that's had an ACL reconstruction. But what about a PCL? Like, there's tons of research on how to do rehab on people with ACL reconstructions, but PCL is much less prevalent, or I should say, the incidence. I use the wrong term there. The incidence is much less. The rate of PCL injuries is much less than ACL injuries, and so you're not going to find as much on PCL. So that might be something of interest. Or if you've got, and this is something I wish I could have done um, back in the day when I was working up at Southwest Washington Medical Center. I had a patient come through, and as she came through the door, she had the oddest looking gait that I had ever seen. And I was really excited, like, wow, this is going to be some sort of crazy knee condition. Because I knew that she was a knee injury, but the way she was walking, it was the weirdest thing I'd ever seen. And she didn't have crutches, and she didn't have on any type of brace. That wasn't a surgical condition. Well, as I started to talk to her, I found out that she had been referred by a referral source that had not seen her. And why hadn't they seen her? Because she had been adopted by a Christian Science family and thus hadn't been, utilizing doctors ever in her life. And it wasn't until that I did this workup on her, I couldn't figure out what's going on. It was the weirdest thing I had ever come across. So we got her in to see a physiatrist, not a psychiatrist, a physiatrist. A physiatrist is a physical medicine and rehabilitation doctor. And she had a form of muscular dystrophy that nobody had ever diagnosed. But she had lived her whole life as a successful business person and had just done everything because that's the mindset that her parents had instilled in her, that this is the way God had made her. So, really a fascinating case. That would have been a perfect one to write a case report on. So, when you've got somebody that comes through that is different than what you're used to, you want to gather information on that person. You want to make sure you keep good notes. You should always be keeping good notes, but maybe you keep even better notes. You may even want to get notes from her referral sources or his referral sources and have extra information to include in your report, because you're going to be telling that patient's story within the article. Obviously, you're going to de identify it in some way. You're not going to be, it's fine to say 48-year-old Caucasian female, but what you wouldn't be doing is saying Jane Smith from Vancouver, Washington. So you're going to tell the patient's story and then reflect on the lessons to be learned in the discussions section. So again, selecting cases, unique clinical or practice problems. That's what we're looking for. Or common problems or challenges not addressed in other forms of the literature. So here's an example of one that I published. Common problem is iron deficiency with anemia. This was an interesting case because I was working with a college female athlete. By the time she got to me, and I think I talked about this case in physiology last term, but by the time she got to me, she had seen a variety of different healthcare providers, and none of them had figured out that she had iron deficiency. And it wasn't until she was referred to a hematologist that that diagnosis was made. So if publishing this in a sports physical therapy journal was really valuable because if you're working a running clinic or working with runners and somebody's coming to you and saying, I'm tired, you know, I just don't have the same kick anymore, et cetera, et cetera. Don't necessarily focus on their musculoskeletal complaints. Gotta, dig deeper. Find out, okay, are you getting enough sleep? Are you overtraining? Are you eating? Oh, you're not eating protein. Oh, okay. Other things with selecting cases, again, looking at measurement related issues. So you're documenting something about uh, the measures that you take. Differential diagnosis. This case here, this iron deficiency with anemia case, that could kind of fall into differential diagnosis a little bit. Algorithms or clinical pathways, looking at things like returning people back to sport, returning people back to work. New intervention strategies. A few years ago, a physical therapist named Tim Tyler came up with an exercise for people with tendinosis, the degenerative tendon changes of the lateral elbow. Well, Tyler came up with an eccentric exercise using the flex bar. We've got some of those in our department. And he went straight to the research side of things, but he could have very easily done a case report illustrating the improvements a patient made while incorporating the use of the Tyler twist. Again, cases can also address ethical dilemmas as well as community-based interventions and administrative issues. So now let's look at the anatomy of a case report. And again, as I talk here, I'm going to be not only going over what you're going to find in a case report, but also doing so in a way that hopefully will get you thinking, oh, okay, I can see how I could write one of these when I am a practicing therapist. So case reports usually include concise description and discussion of relevant literature, a statement of specific question or clinical practice hypothesis, documentation of pre and post intervention examinations, as well as a description of interventions. Also include the outcomes that are measured and an informed discussion regarding the relevance of the case to practice. So what you should see in a typical case report is an abstract, an introduction or background section, a patient or client description and history, the examination process, a discussion about the diagnosis and the prognosis, the interventions used, the re-examination that occurs at the end, and a discussion and a conclusion. Okay, the abstract section. This is a brief summary of the report. All articles have an abstract. It's usually made up of 2 to 4 sentences summarizing each section of the outline. You'll also notice some articles will put a level of evidence, and this is where you'll see a 5 for the case report. And then near the abstract are the key words. So here's an example of an abstract. You can see down here at the bottom the level of evidence. This journal called for that. Not all of them do, but some do. And then the keywords. And keywords, again, are words that might help you find this article when doing a search. There's an introduction or background section, and this places the report in context. It explains the purpose for writing the report. Within the introduction section can be a theoretical framework, and what that is, it's the summarizing of of relevant literature, and it's an area where you can identify gaps in knowledge. So, for example, with our blood flow restriction paper, we highlighted in the introduction section that a common conservative treatment is the use of eccentric exercise to load people either doing a heavy slow resistance program or doing a single leg squat on a decline board. We also noted, though, that not everybody gets better with conservative care, and not everybody gets better with surgical care, that it's been documented in the literature that a certain percentage of people will give up or retire prematurely from sport participation. So, our thinking here is what if we were able to get the same physiologic benefits of exercise while loading the individual less? So, can we use the blood flow restriction to trick the body into thinking it's working harder than it actually is? And so, in this section, also, we describe the theory supporting the intervention approach and any examination approaches that we take. There'll be a patient description and history section where you're describing the patient or the client and you're telling their story and you're summarizing their concerns and reasons for seeking care. In the examination and evaluation section, this is where you're going to be describing the examination strategies and tools used. So if you're utilizing a particular piece of equipment to measure something, is it reliable and is it valid? So, like if you're using a handheld dynamometer, it's always good to say what its level of validity is and the reliability of it. Or if you're utilizing different orthopedic special tests, what is the sensitivity and specificity of those tests? You're going to detail the findings of your examination. You're going to relate your clinical thinking and decision making as you proceed through the examination, and then summarize your judgments and conclusions about the findings. And so, for example, in the blood flow restriction paper, I have an athlete 1 section and an athlete 2 section for my exam. Also, you're going to highlight, here's another thing related to reliability and validity. Could put information in there regarding the use of diagnostic ultrasound. And so these were images that we collected. These are the baseline images of the right and left tendons for athlete 1 and athlete 2. And so we're able to show baseline comparisons between the two and highlight the blackened or hypoechoic areas. And it's always good to have tables to present your pre-test and post-test measurements. The diagnosis prognosis section is always valuable, especially if you are seeing the individual practice without referral. So you're going to come up with a medical diagnosis as well as any type of PT related diagnosis. And it's good to state your time best expectations for outcomes. So what's the prognosis? Well, the prognosis for jumper's knee would be that a certain percentage of people are going to be better with conservative care in a 12-week time period. And so you're going to find that information out by going to the literature. Intervention, this is really valuable for sharing information to other clinicians where you describe your intervention plan, providing a timeline as to when you included or removed things from the treatment plan. Make sure you describe adjustments or deviations from that plan, explain or describe the patient's response, and describe any interdisciplinary efforts and factors external to the intervention plan. So, what does that mean? Well, that would be like the hematologist changing the person's iron supplementation while at the same time I'm working with her back and hip complaints. So good to include obviously pictures in the intervention. So showing here, we did 2 exercises. We did a single leg press and the single leg squat while the person had applied blood flow restriction therapy. And then the exercise program is detailed here for the 12-week period that we saw these 2 athletes. Going to have a re-examination section. Again, you're going to have to To tell a complete story, you're going to have to discharge, do all the same testing again to see what changes occurred. So you can detail findings and then make comments, summarize what was successful, what was not successful, or what changed and what didn't change, and why you think that was. And then in the discussion section, this is where you really do a lot of your discussion about the strengths and weaknesses of the article, and also discuss what potential future research should occur. Okay, let's talk about effective communication when it comes to communicating within a case report manuscript. Now, you want to write it the way you'd like to read it. Now, that doesn't mean we're using conversational language. We're still using scientific or technical writing, but think about if you were reading the article, what would you want to see in there? What would be valuable to you? So that's what I mean by write it the way you'd like to read it. It's also very important to include graphics, photographs, diagrams, tables, lists, line graphs, and bar graphs. These are all really, really important, and these are things that clinicians really find valuable. Photographs, pictures worth 1,000 words. So right now, you're looking at this and you're going, oh, okay, I see figure 1 says posterior power line, figure 3 says posterior stabilizing line. Well, if you were looking at the article, you would know that these were 2 of the 5 positions of the bunkie. The bunkie is a core, well, it's not really core. I've called it a testing program for the core. The South African physical therapist that came up with it, she believes it measures fascial tightness, tightness within the fascia, which it doesn't. There's no evidence to support that. So what I did though is I looked at these different positions of the bunkie and I was like, man, those can assess asymmetry potentially. And so I was really curious about it because I had been working with runners in the past and using some common core tests, but these core tests didn't do a very good job of identifying dysfunction in people. But the bunkie really caught my attention because, oh look, there's 5 positions that people are in, and they're performed bilaterally. So these look like really challenging positions. Let's play around with this. So what this case report was is I utilized the bunkie to highlight weaknesses in her core region that were associated with the pain that she was experiencing and the abnormal or Trendelenburg gait that she had when running. And so if you weren't familiar with the bunkie, it's very hard to kind of describe these positions. So again, a picture's worth 1,000 words. You could see the test positions. And so the exercises or the positions help to, the picture show help to clarify the impairment or intervention technique. And in this case, it would be the examination approach. Photographs. Want to include photographs, typically black and white. You zoom in on the detail, limit the distractions. This one came from my female wrestler case report. There are a lot of distractions in this one, but this was also the athletic training facility at that university. Fortunately, they didn't ask me to take another one, but I can see how it could be a little, um, you know, too much going on in there. It'd be better to maybe have her against kind of a pure white wall or blank wall. Important to label according to instructions from the journal, provide a legend if necessary, provide a photo credit in case somebody else took the picture, and make sure to get written permission. Written permission if you are using the patient or client. I try to avoid that by I just use my colleagues, and or written permission if you want to use a um, picture from a different article or a different source. Diagrams, these summarize or graphically define a theoretical framework. They can explain a mechanism of an intervention or describe a clinical pathway or care map. So let's look at some examples here. I don't see too many of these in case reports. This would be a diagram related to the theoretical framework. Timelines outline the course of an intervention over time. They clarify critical time elements in the episode of care, and they track progress of a patient across care settings. Again, I don't see too many timelines, but this would be an example of one. Tables, you'll always find tables. Tables report things like our measurement data, patient's response to interventions, and it can help define intervention parameters. With a table, keep it simple and clear, provide a key for all abbreviations, use lines sparingly. So sometimes this is too many lines. In Word, you can take out a lot of these lines and it just makes things look a little cleaner, a little nicer. Clearly label columns and rows, provide a title, and of course, number them consecutively in your article. Here's a table example. This one comes from the Bunky article where I was just discussing the exercises. It was really a short treatment approach. She was having pain. She was having pain every time she would run, and then gave her the exercises, basically just trying to get her to use her left glute. And so we were focusing on some core and left glute stuff, or glute stuff in general. And about a week later, she was back to running again without having pain. So it wasn't really a big severe thing, but this is the exercise program that I used, and so others could draw inspiration from this if they read my article. Lists are used to describe intervention protocols or activities, to detail goals of interventions, to list patient impairments, and to use or are used to highlight important points. Use lists alone or within tables. Use a consistent format and keep simple and to the point. There's an example of a figure there showing a list, and here's one from the article that I did, the case report that I did for the female wrestler. And so this was a list just showing the different phases of the rehab program. Line graphs show change over time. They track progression of an intervention, and they can track outcomes. Again, you need to label both axes, use consistent intervals, use black and white line graphs because journals don't like to publish color-based ones. Identify by a figure number, provide a complete and detailed legend, and they should stand alone. So you should be able to look at that and get a good sense of what is going on without having to read the associated text. Bar graphs, these compare an intervention or measurement conditions. They compare outcomes to an initial examination. Again, same things as line graphs. You want to label them, use consistent intervals. They need to be black and white. The figure number should be there. You should have a complete and detailed legend, and they should again stand alone. And again, it's important to use graphics generously. References. Journals will want to have references in AMA or APA format. And if you were ever interested in doing stuff like this, it's always valuable to have reference management software, because maybe you write your article first for a journal that uses AMA, and then say it got rejected and you go to a journal that uses APA, the reference management software can convert things over for you. Now looking at the submission process here, you'll never get published if you don't submit. No duh. Submission process. Follow instructions on the journal website. Ask somebody to review your article before you submit it to see if they see anything. Sometimes I'll look at a paper and I'll go, oh, that's a brilliant paper. That's the greatest paper I've ever written in my life. And then somebody else looks at it and it's like, oh, did you see those errors? Did you see these errors? It's really easy to overlook things that you do wrong. Make sure you've got figures and tables. Make sure you have release forms. So if you've got pictures of people, make sure that they have signed those. And then finally, you want to have a cover letter. The cover letter is valuable because it's a letter to the editor of the journal, and you basically say, hey, we're excited to submit our manuscript for consideration. This is a case report, and we find it to be very valuable for X, Y, and Z. So it gives you an opportunity to have a paragraph or two to really kind of advocate for your article, and that can be beneficial because sometimes reviewers might be like, this really isn't something that we should publish. reviewers feel like they have that power, and so they'll say, "Oh, reject this. This is no good," or whatever. But if the editor likes it, that's all that matters. That's all that matters. If the editor likes what you've done, and so in that cover letter, you can explain why this case report is valuable for clinicians. So the review process, you upload it into the journal's website, it gets received, assigned to an editor, then it goes through a blind review. Usually two people review it. You don't know who they are, they don't know who you are. Again, that's 99% of the time. Sometimes there's open access journals in which you might know who people are, but that's the exception, not the rule. A summary of the reviewer comments will be compiled and will be returned to you. And so you'll see the feedback that they give you, and hopefully it's feedback that's something you can do something with. So you'll revise and resubmit. So you'll address their comments. You'll either make changes based upon what they said, or you'll defend against them. And I've had that happen where somebody says, "Well, no, no, it should be this." And then you have to say, like, "Well, no, the evidence doesn't support that," and basically tell them why. And then finally, it gets re-reviewed by editors and reviewers and hopefully gets accepted at that journal. And if it doesn't, dust it off, reformat it, and submit it someplace else. So if it gets accepted, there's a final review by the editor. There is editing by the copy editor, goes into production. They send you page proofs. Very important to review those. Make sure that they didn't edit things incorrectly. And then if they did, make sure to let them know. Send the proofs back in and say, this is an error you guys made. And then finally, printing and mailing. Basically, mailing, that's not an issue anymore. Everything's done online. Printing wise, they may give you like 50 free copies that you can share with friends. Some ethical and legal considerations. First off, patient confidentiality. We want to make sure that nobody knows or nobody can identify the patient. If you need to take a picture of them, even if it doesn't include their face, you need to get patient consent. So they need to sign a photo consent form and a patient consent form. You typically don't need a patient consent form if you are not doing anything that could identify them. So, of the 5 or 6 case reports that I've published, not once did I get patient consent because nobody can figure out who they are. Nobody is able to identify them. Facility concerns, this would be just to make sure that you don't have pictures which have any other patients in there, or that if you aren't including anything that's proprietary in nature that would make your employer upset. Probably there wouldn't be. Copyright release, all journals want you to sign a copyright release, except open access journals, where if you were to publish in an open access journal, then you retain the copyright. But to publish in an open access journal, you usually have to pay somewhere around a $300 to a $2,000 fee. Non-open access journals, you don't have to pay anything, so don't freak out about that. Authorship, you should include anybody who participated in the process as an author. And then acknowledgments. Acknowledgments may be something I usually don't see acknowledgments with case reports, but let's say somebody like a physician provided information, but it didn't rise to the level which everybody felt like authorship should be granted, and so you could acknowledge them. And in conclusion, here, as long as medicine exists, clinicians will share and should share their clinical case experience with their colleagues. So, case reports need to be written and shared. And I'm just going to kind of blow through some things here really quickly here, some example things, and then you can read the articles that I put onto Foxtail. Again, important to realize case reports are not research, they're non-experimental, but they have lots of strength to them, and they are a way that a clinician can participate in the dissemination of scholarship or the sharing of ideas and stories. So we've seen this one before. I talked about it in physiology class. This was the case report looking at the iron deficient runner. And I really like this table. This one had too many lines in it. I should have, well, actually, the journal, I think, did that. The journal was a new journal at the time, and so their presentation of things was less than to be desired. But what I like about this table is it tracks all of the um, values related to her iron deficiency state, and you could see how those changed over time. And then these were other tables that I included related to her examination process, where we could see her baseline strength measurements and then her um, post measurements. So we can see changes that had occurred, at least with dynamometry. And then treatments per session, looking at what I did, modalities, manual therapy, and therapeutic exercise. Example number two, this is that female collegiate level wrestler. She got better. She was able to go on and compete in nationals. So I included that list within the table format there of the rehabilitation program, and then also included a variety of pictures. All right, that is everything for this screencast. Please take the time to review the um, the articles that have been put on Foxtail, and also please remember that the material on this screencast will be included on one of our quizzes.